guys, welcome back to G Chats with your host Gianna G. But on today's episode, I'm super excited to have my good friend and also my pelvic floor therapist, Dr. Julia Smeltz. She is a wonderful human being, but also a wonderful pelvic floor therapist. And I decided there was no better way to celebrate International Women's Day than having Julia on the podcast. So Julia, I'm super excited to have you on the podcast today.
Oh, thank you so much, Gianna. This is a huge honor. I love joining you here in the G spot. This is absolutely my favorite place to be. And hello to everyone listening, watching. Super grateful to be with you today.
Yay! So I wanted to basically bridge the gap between pelvic floor therapy and vaginal health because I feel like it's not talked about enough, the connection between the pelvic floor. And as you guys know, I specifically study the vaginal microbiome, but I'm really passionate about general female reproductive health. And I feel like I'm always on this mission to bridge the gap between the connection of the vagina and what that means for the entire body. And there's shockingly a lot of connection between the pelvic floor and the vagina that's not talked about enough. So I think this will be a great episode and a great way to bring it all together and bring it full circle. But I wanted to start with you sharing your experience, your journey into pelvic floor therapy, why you got into it, and how it kind of shifted into, I feel like for the most part, and correct me if I'm wrong, but it is centered around female reproductive health, if you will. I do know that you have some male clients, but for the most part, I feel like your passion is centered around female reproductive health. So I just want you to share with the audience a little bit about yourself, why you got into it, how you started, and how you even learned about pelvic floor therapy. Because when I think of a physical therapist, I think of traditional, like, oh, God forbid, like you have surgery and you have to do physical therapy, or you had a car accident. Like there's trauma and then it's, oh, go do physical therapy, which I guess pelvic floor is similar, like childbirth, do pelvic floor therapy, except our insurance doesn't cover it. But, yes. But yeah, so share a little bit about yourself and your journey.
Sure. Yeah. So interestingly enough, I knew nothing about pelvic health physical therapy until I went to grad school. But from a very young age, I knew that I wanted to be a physical therapist. I pretty much knew that like straight out of the womb. My mom was a physical therapist. She did sports and ortho. Her practice was like a mile down the road from the old farmhouse that I grew up in central Pennsylvania. And my brother and I basically grew up in my mom's clinic. So my perception as a kid was like, oh my gosh, my mom goes to work and she plays all day with trampolines and huge Swiss balls and balance beams, and she makes people happy. And I was like, that's exactly what I want to do. I want to play all day and make people happy. So knew that I wanted to be a physical therapist, went to athletic training school, then went to grad school in Pittsburgh for physical therapy. And it was during my experience in PT school that I was introduced to pelvic health and was very lucky because at that time, pelvic health really wasn't talked about at all in physical therapy school. Like it's changed a lot, but during that time, even in the anatomy class where you were learning about every single muscle in the human body, there was like a black box over the pelvic floor muscles. And something along the lines said like, hey, these are some muscles that if you're curious about them, you can explore them after you graduate. Like some people specialize in that. So it was very like taboo. We weren't even talking about it. So very lucky that in my program, we had a 2-hour lecture and 2-hour lab about pelvic health, which in the grand scheme of things, 2-hour lecture and lab, that's nothing.
Right, yeah.
But also, like, my intro to that was not the best. Like, I'd never seen my mom do anything pelvic health related. I knew nothing about these muscles, these structures. And, like, my mom was my hero. So I'm like, if my mom wasn't doing this, it must not be important at all. So I basically wrote it off. I remember turning to my friend Jill in class and being like, this is dumb. Like, there's no way I'm ever going to do anything like this. No pelvic health for me. Sports ortho. I want to work with athletes. But as it would happen, life had other plans. The universe absolutely conspired against what my plans were,
Right.
and opened up a lot of doors for me to learn more about pelvic health. I was living and working in Chattanooga, Tennessee at the time that I started my pelvic health practice, because I realized there was a huge need for pelvic health care. There was also a huge need for me to get out of my current work environment that was super toxic.
Yeah.
And it was a door that was open. So I was like, hey,
Oh, I love that.
here's this door. I will explore pelvic health. And if I feel like it has any validity, maybe I'll go down that path.
Yeah.
And as soon as I started exploring it, I was like, oh my gosh, like, I can't believe that I was never told about this.
Right. Yeah. Yeah.
Because just like you were saying about connections, the pelvic floor is connected to everything.
Yeah.
Literally everything. And it was just blowing my mind. And I was like, wow, here I am as a physical therapist, defined as an expert in human movement.
Yeah.
And I'm learning for the first time in my career where the seat and the origin of all human movement originates from.
Yeah.
It's the pelvic floor, those blacked out pelvic floor muscles on my anatomy slides. And then I'm learning, like, oh, 95% of chronic low back pain has a connection to our pelvic floor health. And I'm like, wow, never even knew that these pelvic floor muscles existed. How many times have I treated someone with low back pain?
Yeah.
So it was definitely something where I was like, wow, everyone needs to know about this. And I can't believe that we're not talking about it. And I have a lot of Aries in my natal chart. So I was like, if I see anything where I'm like, this isn't right, this is not fair, I'm going to try and change it.
Yeah.
So that's kind of how I got my start. So I started my practice in Chattanooga, Tennessee, doing in-home care for new moms. So my car was my clinic. My very first client was my chiropractor.
Aww.
And that's where it all kind of started.
I love that.
Yeah. So 7 years later, have my own practice here in Bethlehem, right across the river.
Yeah.
And it's amazing. It's very much like your space here. Like, I get to create in it, and I get to create the brand of physical therapy that I want, and I get to work for my clients the way that I believe they deserve to be cared for.
Yeah.
So that's been my start.
That is so, it's everything that Julia is saying I relate to so much, because as you guys know, I mean, I talked about my journey, and Julia's familiar with my journey into the vaginal microbiome. And it was because once I found that hole of all of the antibiotics I was taking for my UTIs was actually killing my gut and vaginal microbiome and making things so much worse. Once you find that, oh my God, this is like the connection, that aha moment just puts it lights a fire under your ass that you're like, I need to keep going. So I relate to that, and that resonates with me so much. I think one of the frustrating parts with pelvic floor therapy is it is treated as almost like a last resort kind of thing. It's like, let's try all of these things that possibly make it worse, and then we'll send you to pelvic floor therapy. So for the record, guys, I was not referred to do pelvic floor therapy by any doctor that I ever saw. I sought it out on my own, being a scientist and understanding female reproductive health, which is a problem because the average woman does not know enough about female reproductive health or her pelvic floor. And I talked about this a little bit last episode about all of the UTIs that I was having. After I had one UTI after another, I noticed that then I was having UTI-like symptoms without actually having a UTI. And that made me wonder, like, what is going on? And I had to do a deep dive on what's going on. And for whatever reason, I felt like there was some kind of nerve damage. And that was because I noticed that there were differences in how I was peeing now. It was one of those things that I was like twitching while I was peeing. I was like stuttering while I was peeing. And I realized that there was a connection between my mind and my pelvic floor. I was so afraid of feeling that burning sensation that it was totally like wrecking the mind to muscle connection. And I was like, but I am having burning, and that burning is triggering this fear, and this fear is making me not empty my bladder out properly, which I know in literature makes you more prone to urinary tract infections. So then I'm like, I'm inducing myself with a UTI, and you spiral. And that was where I was like, how do I correct this nerve damage or this nerve issue that I'm experiencing that's causing the UTI symptoms? And that's where I found the world of pelvic floor therapy. And I read reviews and I found Julia, and she is literally so knowledgeable. So I'm just so excited for you guys to learn and for Julia to share the knowledge on this episode, because we resonate with each other so well, and our practices I feel like are so similar but different, but still connected, and I just love that.
It's so true. I'm sure there are other number one fans of Gianna's podcast, but I truly am a number one fan. I've listened to every single episode. I share all of them because I love what you're doing. We're doing the same thing. We're talking about all the things that society's like, don't talk about that.
Yeah.
And it's like, no, we're going to talk about vaginal health. We're going to say vagina.
Right.
Even if it's
no, and I've told you the story of when I was first pitching my business and the probiotics, and I was pitching at a competition, and I literally was saying the word vagina, and then after the competition I had a psychologist come up to me and say, wow, I'm so impressed that you say vagina without like grimacing. What? And I was like, what do you mean?
That's just so sad. It's like, I'm literally talking about my body. Right. Why would I grimace when I'm talking about my body?
That expectation of, wow, you say vagina so powerfully, and I'm like, well,
you do,
right?
Yes. And you have like a powerful voice, no matter what you say.
So I'm like, we should not be afraid to say the word vagina and talk about the vagina, but the fact that was an understood thing, and it was like, wow, she's a force coming in talking about something we don't talk about, and I'm like, this is why I'm doing what I'm doing, because we should be talking about this. So yeah, no, I get it.
Absolutely. And that is my world, talking about all the things that society's like, don't talk about that, breaking down all the taboos, talking about poop, pee, sex, menstrual cycles, vaginal health, menopause. I mean, it's nuts that literally the world is now just starting to talk about menopause.
Right. I know.
Like, we just had the world's very first documentary on menopause released last year. And that's just nuts to me. We should be talking about this because this is our reality. This is our body. And the way that we see ourselves influences the way that the world views our bodies and how policy views our bodies.
Yes.
And that's so important.
Especially when menopause will affect half of the population in the globe, on the globe. Like,
maybe that's important.
Half the population is going to deal with menopause, and yet there is less than 2.5% of funded research that goes into studying things like menopause, endometriosis. It's unbelievable. So, and I think that like radicalizes us to want to study this. Like, it makes us want to do what we're doing, because you see, and I literally just made that TikTok video yesterday, and that was one of the things I included about how little funding goes into female reproductive health, and yet there is like 6 or 7 times that percentage that goes into studying and funding companies that study erectile dysfunction, which only affects 19% of men. And I want to preface, I'm not saying that erectile dysfunction should not be studied. It should be. Everything reproductive health, male, female, whatever, yes, be studied. But there's a drastic disparity between the two. And there's obvious like discrimination that takes place. Like, there's obvious issues with how it's being studied.
Yes,
like,
exactly. And just looking at like what is society's perspective on this? It's like, as soon as there's an issue with female bodies, it's like, well, let's just take out organs. Right. Let's cut out your ovaries and your uterus. Right. Like, that narrative is not true for male bodies. It's not. If they're having erectile dysfunction, it's like, oh, okay, there's something going on with your penis. Shall we just cut it off? Right. Like, that is not the story. That's not the narrative.
Just was speaking to somebody, and we'll get Julia's live reaction to this.
Oh, dear.
But she was telling me that she had years ago recurring yeast infections to the point where like her doctors, of course, didn't know what else to do for her. They tried every kind of antifungal and nothing was working. And their suggestion, the next step, they were like, well, we can cut out your vulva.
Oh my God. I'm like cold sweating now.
They suggested cutting out her vulva. When she told me this, I audibly gasped. I was like, no, you're lying.
Oh my gosh.
So guys, we are so familiar with the issues in this space. So I think like this is a great segue for Julia to tell the audience and to tell me what the pelvic floor is. I want you to explain a little bit of what the pelvic floor is, anything that you think is like necessary just with your
Yes.
anatomical figure. Let us know, what is the pelvic floor?
Yeah, absolutely. So number one rule as a pelvic health physical therapist, you always have to have a pelvis within arm's reach. That's just the golden rule. So I do have my pelvis with me today, and I may ask you to hold my mic.
Yeah, whatever you want. I will put mine down.
Awesome. Cool. Yeah, we'll do a little switch here. So very first thing we should all know is that we all have pelvic floors. It still blows my mind the number of clients that come into the space, they're seeking out pelvic floor physical therapy, and they're like, well, yes, of course, I know I have a pelvic floor, but my husband or my male partner doesn't, right? I'm like, no. Every human has a pelvic floor. If you are living, breathing, moving, you have a pelvic floor. So let's explore kind of what that looks like. And for those of you who are listening to this episode, I do have a pelvic model with me. So if you want to catch the YouTube version of this, highly recommend it. And listen to this multiple times. Like and subscribe. But anyway, so just to orient, so here is our pelvis. If we turn our pelvis upside down, everything we see in red here is our pelvic floor. But what we're looking at right here on the model is literally just layer one of the pelvic floor. So there are 3 layers of our pelvic floor structure. There are 15 muscles within this complex as a whole. This is a female-oriented pelvis. For male-oriented pelvises, they have 17 muscles in their pelvic floor because they have an additional appendage. So the model that I have with us today is a female-oriented model. So we have 3 holes on the bottom of the pelvis, our urethra opening, our vaginal canal, and our rectum. And like I said, looking at layer 1 of the pelvic floor on this model, we can see that layer 1 is creating muscular circles around the holes on the bottom of the pelvis. So if we really distill down the job of layer 1, we can say these are squeezer muscles. They are creating sphincteric effect, squeeze on the holes on the bottom of the pelvis to make sure that poop, pee, gas, babies are staying inside of our bodies until we want to release them. Layer 3 of the pelvic floor is our deepest layer. These are essentially our supporting muscles, so they support and stabilize our pelvis for every single movement that we do, and they also hold up and support our pelvic organs. So for our pelvic organs, we have 3 of them. We have our bladder here in the front, we have our uterus right behind the bladder and resting on top, and we have our rectum. So layer 3 of the pelvic floor is literally holding up and supporting our pelvic organs, which is a really important task to do for all stages of life, and especially during pregnancy when uterus expands to 100 times its size and we're growing a baby in this space. Pelvic floor is holding up and supporting all of that. So layers 1 and 2, we can say our squeezer muscles. Layer 3, we can say our supporting muscles. And it's really interesting because within that 15 muscle complex, every single muscle of the pelvic floor has its own specific job. Every layer has specific jobs that it does, and the complex as a whole has specific jobs. So our pelvic floor moves with our breath. It's operated with our breath, which is why our breath is so important and why returning to our breath is really important. Most of us are very shallow breathers. Yes. And when we don't get our breath, our life energy, our prana down into our pelvic floor space, we lose our awareness of that space. We lose control in that space. And that is a big kind of driver for pelvic floor dysfunction when we get disconnected from that part of our body. So pelvic floor has a number of different functions. We'll probably get into a lot of them today, but that's essentially what the pelvic floor looks like. It extends in the front of the body from our pubic bone, goes all the way to the back of the pelvis, fully encases our tailbone and the lower 2/3 of our sacrum, and then extends out to our ischial tuberosities, our sits bones, where our hamstrings attach. So interesting things if you've experienced like pubic symphysis dysfunction or lightning crotch during pregnancy, right? You can feel that connection of the pelvic floor in the front of the pelvis at that pubic bone attachment. If you're experiencing low back pain, we know 95% of chronic low back pain cases have pelvic floor dysfunction involvement, and that's because the pelvic floor in the back fully encases that tailbone and our sacrum, the lower 2/3, and those areas of our body need to move with our breath. So every time we inhale, we wag our tail up. Every time we exhale, we wag our tail down. And if the body can't find that motion from that area, it's going to look for it somewhere else. Right. And the next place it's going to look for it is the lumbar spine. And then we're trying to get a lot more movement out of our lumbar spine, a place in the body that craves more stability. Right. And the body's going to send us a message via pain, something that's going to get our attention and say, hey, this needs to change. We need more support.
Yeah.
Thank you for your help.
Yeah, no, of course. Yeah, no, that makes so much sense. Because when I think like the very first appointment that I had with you, the first thing that we tested was my breath work.
Yes.
And it was so funny. It was as simple as Julia told me to place one hand on my chest and one hand on my belly and was like, breathe in. And I thought, it was like, what the heck? Like, okay, like this is weird. All right. So I took a deep breath in and it wasn't so deep. I thought it was, but it in fact was not. Absolutely nothing in my like where my stomach is, nothing moved. And Julia was like, I want you to breathe in again, but this time I want you to feel your stomach expand. So breathe in with the intention of expanding your stomach. And I remember I took that first breath and I was like, holy shit, I've been breathing wrong this whole time.
Yeah.
Like that was wild to me because I didn't realize how little of breath I've been getting into my pelvic floor.
Yes. And this is super common,
Yeah.
and it's not really our fault. There's a lot of
Yeah.
subconscious messaging in our society, especially for women, where it's like, hey, don't let your belly move. Like,
Right.
suck your belly in.
Yeah.
Wear these tummy control, like, leggings.
Yeah.
And when we don't allow our belly to move, we cut off our connection to our pelvic floor via our deep core system,
Yes.
which is probably another system we'll talk about today.
Yeah.
But our pelvic floor never works alone. It always works as a part of our system. The system that it is intimately connected to
Yeah.
is our deep core system.
Right.
And that deep core system is our pressure management system. It is
Yeah.
essentially a canister of muscles within our body, deep within our system. Our pelvic floor is the floor of that system. Our diaphragm's the top. And then our deepest abdominal muscle, our transverse abdominis, makes the walls of that system. And then our multifidi muscles, little muscles that go up and down the spine, make the back wall of that system.
Okay.
But in order to create energy in our core, to brace our core for all movement, whether we're taking a step, running or walking, laughing, coughing, sneezing, picking something up, pushing something, whatever it is, any movement, right? Our core has to be able to activate to support us in that movement.
Right. Yeah.
And the way that works is with the breath and that belly movement, right? When we draw in breath, the whole system expands. It gets potential energy. Our belly has to move out. That transverse abdominis has to expand. And then as we exhale, we draw energy from our pelvic floor and transfer it up through our core system. And the muscle that does that transference of energy from our pelvic floor is our transverse abdominis. It's that zippering in and out muscle,
Yes.
our body's natural corset.
Yeah.
So when we constrict that corseting muscle and say, hey, don't move, then we're basically disallowing our body to draw energy from our pelvic floor and to create that powerful brace from which we can move from.
Yeah.
And I do believe that, my personal opinion, I'm like, patriarchy, very, very smart, very clever. They're like, if we can take women away, like out of their bodies and away from their power so that they cannot create power within their core, they're going to be more controllable. So greatest thing you can do today to break down the patriarchy is breathe into your deep core system. Feel that breath come into your belly. Let your belly move, and also feel that breath come into the sides of your rib cage, come into your back body as well, so that you can be really powerful with all of your movements. And then also like huge energetic connection there as well. So for anyone who's familiar with the chakral system, our first three chakras are right within that deep core system. Our pelvic floor is the house for our root chakra, which is all about safety and security. At our sacrum, that's where we have our sacral chakra, which is all about creative energy, sexual energy, reproduction. And then right below our belly button is our solar plexus, which is all about our sense of personal power, autonomy, that we can stand firmly in the things that we believe in and make change. So if we take away that energy and take away that power, we affect ourselves energetically as well, and it affects how we show up in the world.
Yeah, I think like that's just not understood or even discussed. And I know this is a bit of a, like, we likely would get to this later in the episode, but this kind of triggered a thought in my mind that I didn't think to like add as a question. But I know that so many women after, and we were talking about, like sucking in your stomach and stuff like that. And even for me, like I feel like it was very normal for my mom to be like, suck in your stomach.
Yeah.
Don't stick your stomach out when you're walking. And so I would do that a lot. And I notice now, since I've been doing pelvic floor therapy, if I wear like, let's say yoga pants or leggings that have that like waist snatching element and it's tight on my waist, I actually notice that I get very uncomfortable
Yes.
with my like intestines. I feel almost bloated and like gassy, if you
Yeah.
will. And I've thought, I'm like, what? Am I not normal? Except I realize that that's actually the right response that my
Yes.
body is having because I'm constricting my pelvic floor from just being loose and being able to breathe into it. I'm so tense that like if I come to my office and I wear those tight restrictive leggings all day, I start to notice like by 5 p.m. I'm like, I'm having like gastrointestinal issues right now. I almost feel gassy, bloated. Like I feel like I've just been squeezing my intestines.
Yeah.
And that triggered a thought just now because I know so many women, and I want to hear your thoughts on this. After childbirth, a lot of them say like once they give birth, they actually put on a waist trainer or a faja. And I wanted
Yeah.
to get your thoughts on it because I see it on TikTok all the time where people are like, put the faja on right now. It actually holds all your organs together and stuff. So what are your thoughts on people waist training and wearing a faja like immediately after giving birth and after getting out of labor?
Yeah, this is such a good question. I was literally chatting with a group of pregnant mamas last night at a local Pilates studio about this. So very, very good.
Yeah.
So kind of typical phrase in physical therapy is it depends.
Yeah.
It depends what kind of delivery did you have? Was it a vaginal delivery? Was it a C-section? Were there complications? What is the state of your pelvic floor and your deep core system and your connection to it?
So it's dependent on each client that each patient.
Definitely,
Yeah.
definitely. Now I've seen so many different like waist trainers, belly binders, corsets, belly wraps. They're all kind of different, right?
Yeah.
So like belly wrapping is a technique that has been used throughout South America, Southeast Asia, and typically within those cultures, like there is a local grandma, Nona, who like travels from village to village and every day wraps the postpartum ladies.
Wow.
And it's like, hey, if you have access to a Nona who's going to come and do your belly wrapping every day, amazing. Like that's great. Most of us probably don't have access to that.
Right.
But the way that belly wrapping is done is it's essentially mimicking the job of our transverse abdominis.
Okay.
So during labor and delivery, we have this rush of energy down and out. During postpartum, we want to collect that energy and bring it back up and in. And it's our transverse abdominis, which is that muscle that draws everything back up and in and helps our organs that were pushed in all sorts of places during pregnancy find their homes again and feel safe. So when we mimic the job of the transverse abdominis, we do our body a lot of good. And if we think about healing, right, it takes about 1.5 to 2 months for our uterus to shrink back to pre-pregnancy size. We're thinking about that wound in our uterus where our placenta was, that dinner plate sized wound that has to heal. So whenever we're facilitating healing, like just if you have any injury in your body that you want to heal, they always say elevate and compress, right?
Yeah.
That compression is super helpful, but it's all about how we compress. So I see a lot of belly binders and compression bands that are just squeezing everything in. And when we're squeezing everything in and not allowing the transverse abdominis to do its job, we weaken our cores.
Yeah.
So instead of supporting them and strengthening them, we are taking away their power. So any belly band that mimics the job of the transverse abdominis is what you're looking for. I have clients who bring in like the 10 that they bought on Amazon to try, and they're like, all of these feel terrible. And they have like Velcro all over the place. Sometimes there's like literal like overall straps. And I'm like, yeah, this is just adding so much compression and it's not helping. So if you're looking for belly bands for support, you're looking for something that is going to mimic the job of the transverse abdominis. And I have no affiliation with this company, but Love Steady is a great company. They're the only belly bands I actually recommend because they're created by a pelvic health PT and they mimic the job of the transverse abdominis. So no affiliation with that company, but thank you, Love Steady. Great company.
The more you know. No, that's very important because I see it all the time, but I feel like, of course, it's it's probably the concept, like right idea, wrong execution.
Exactly. Yes.
So the idea could be right, but it's not being executed properly. And so like knowing this information is very helpful to understand why belly wrapping can be beneficial. Maybe not for everyone. I feel like nothing in the space is a one size fits all.
Exactly.
And that's why it's very important to find a pelvic floor therapist and have these conversations. I told Julia, when I get pregnant and I'm having kids, when I start having kids, I will faithfully, as long as she is practicing, I will see her, because whether you are pre-babies, you don't have any children, and you've had urinary tract infections, whatever the case may be, you don't have to have a urinary or vaginal infection to see a pelvic floor therapist.
Yes.
So many people have a hypertonic pelvic floor just because of chronic stress, their upbringing, how they grew up, their story. We talk about story a lot and how it impacts the pelvic floor. So I want you to share a little bit about the connection, especially because my whole business is about vaginal health and urinary tract health. Can you share the connection between the pelvic floor and the urinary tract and the vagina? How is it connected, and how does it cause any of those uncomfortable symptoms that can mimic urinary and vaginal infections? So let's talk about that connection a little bit.
Yes, absolutely. So speaking about urinary tract infections first. So our urethra, which goes from our bladder and helps urine exit our body, travels through all three layers of our pelvic floor. So if we have constriction, tightness within our pelvic floor muscles, that urethra is going to be compressed.
Yeah.
So when we want to fully empty our bladder, it's going to be a little bit more difficult to do so.
Right.
And maybe we aren't fully emptying our bladder. So now we're having that acidic urine hanging out in our bladder longer, basically creating more of irritation within that organ. Another thing that we can see is our pelvic floor muscles, they are very sensitive to stress, trauma, and story. They react to everything, and that's because they are the gatekeepers for our reproductive organs. So our body's number one goal is to keep us safe and protected at all times. Body's number two goal is, hey, let's keep you safe and protected so that maybe you'll reproduce and humanity as we know it will continue to exist. Like those are the big goals of the body. So the body's going to be very protective of our reproductive organs.
Yeah.
And because our pelvic floor is that gatekeeper and that protector of our pelvic organs, it's going to be very sensitive to what is happening internally and externally. It's going to be constantly looking for threats in our environment, and it's going to be responding to those threats before any other system in the body. So if we had an infection, if we had a UTI, if we had BV, the pelvic floor is going to be very sensitive to that, and it's going to contract and shorten in order to protect that area as healing's occurring. Or if we, had a UTI in the past and now we're feeling like, oh my gosh, am I feeling stinging and burning again? And the pelvic floor is like, I don't know, let's protect.
Especially too, because most urinary tract infections are bladder infections, because the urinary tract is made up of three parts: the urethra, the bladder, and the kidneys. Most urinary tract infections are in the bladder, cystitis, and that falls literally right in the pelvic floor. So that is like the area, the zone that it's like, unfortunately, in like the part that the body is going to react the most with.
Yeah, absolutely. And they say once you have a UTI, you are way more likely to have subsequent UTIs. And a driver of that is because our pelvic floor tightens and shortens. It decreases the length of our urethra. So then any bacteria that wants to get into that space has a much shorter path to get there than it typically would, which is a big reason why women see a lot of UTIs. Men typically don't, because their urethra is so much longer.
I tell everyone when we talk about urinary tract infections to think of it as the itsy bitsy spider.
Ooh.
And it's literally the itsy bitsy spider climbed up the water spout.
I like that. Yes.
And our bladder is meant to, and we'll get into this a little bit, but pathogens can migrate from the rectal mucosa to the vaginal mucosa. But the good thing is that your bladder and your kidneys are meant to constantly flush any pathogens, because I think there's a misconception that urine is sterile, and doctors think that urine is sterile, and it is not. Urine is not sterile. There is always pathogens existing and living in the urinary tract.
It's the stuff your body's trying to get out.
Right.
It doesn't want it
Exactly.
in.
And so your body is constantly, a healthy individual will constantly have that flushing mechanism. And the thing is even if E. coli is present, and E. coli is responsible for 90% of the urinary tract infections that we see, specifically bladder infections like cystitis. And your body will, even if that E. coli is at the water spout, which is the urethra, it will, down comes the rain and flushes it out.
I like this. I'm such a visual person.
Right, and
this
it's like
analogy
perfect and
feels good.
perfect. So you can like get the idea that even if E. coli is at the urethra, it is meant to flush it out. And so, but unfortunately, with both our butthole and our on the pelvic floor muscle, the butthole and the vagina being so close together, and it's an opening versus like a man has an external like penis, you know, and also our urethras being shorter just naturally than the male urethra, but also that stress, trauma, story, infection, it can cause that tension in the pelvic floor that further shortens the urethra and makes you even more susceptible.
Yes, and then even if you don't have an infection, you can have UTI-like symptoms just because you're feeling the tension of the pelvic floor.
That was me.
Yes,
Yeah.
So then everyone's freaking out because they're like, oh my gosh, I have a UTI. And then you go and you get it cultured and it's like, no, you don't. And it's like, well, what's going on? Why do I feel all these symptoms of a UTI, but yet there's no infection? So that is very much the pelvic floor being in a pain cycle where it was protecting while that infection was active, and it's continuing to protect and guard that area. But when we protect and guard, like a muscle for it to be healthy or a system for it to be healthy, it cannot just remain contracted. It can't be guarding, protecting all the time.
Yeah.
For it to be healthy, it has to be able to go through its full range of motion. It has to be able to fully relax and fully contract.
Yeah.
Because that's how we get control, and that's how the system feels safe. So if we're just here and here trying to operate, it's going to feel way different in the body. The body's going to be like, something is not right, versus here to here.
And another thing to think about too, and actually the episode that's coming out today it did at 10 a.m. I released it was the UTI 101 episode. And I talked a lot about how newer literature and newer science is highlighting that for urinary tract infections, the thought and the idea has always been for a really long time that pathogens just migrate from the butthole to the vagina. But recent research is showing that there is translocation pathways inside of the body where, I mean, we all know E. coli is coming from the GI tract. We all know that it's coming from our intestines and from our gut. That's where the E. coli comes from. But now there's research showing migration pathways through the bloodstream, through the gut permeability, the intestinal lining, through the lymphatic system.
Whoa.
And so if we know that E. coli comes from the gut, and research is highlighting that people with SIBO, IBS, people with a leaky gut, all of these people are more likely to have a urinary tract infection. In fact, there was a research study that was done that showed that the UTI patients, 90% of the UTI patients in this study, they all had gut dysbiosis, so an imbalance in their gut microbiome, which this clinical evidence further highlights that the issue with urinary tract infections is the gut. And I imagine because the gut is sitting right in the pelvic floor, what does that mean for now? Now you're having urinary tract infections and you're having this pain that you feel, this burning sensation in the vagina and in your urethra and in your bladder. But then you're also having a leaky gut or inflammation, systemic inflammation that's occurring in the gut. So what does that do to the pelvic floor?
Yeah. Well, I have to just like talk about this moment right here, because here I am learning so much, like sitting on the couch in the G-spot talking to my bioengineering bestie. Love this. So yes, I did not know that research. That is amazing. But so our pelvic floor, very sensitive to stress, trauma, and story. It is going to respond to inflammation by tensing up and tightening. So if we're having any gut dysbiosis, if we're having any dysbiosis in our vaginal microbiome, the pelvic floor is always going to be responding to that. And our pelvic floor's response is it's our protector. It's going to protect us. And this is where pelvic floor physical therapy, pelvic health PT is really important because the pelvic floor is going to stay in that contracted state until it gets the green light that it is safe to release.
Right.
And in our modern day society, like if the pelvic floor, if our nervous system is scanning internal and external environment, being like, okay, when is everything safe?
Yeah.
We're not going to find it.
Right.
Because finding a sense of safety in our modern day society, very, very difficult.
Yeah.
Because we were not meant to live in this environment of chronic stressors.
Yes.
It's like the water we drink is full of microplastics, the air that we breathe, our relationships and how we are so connected but disconnected.
Yeah.
There's just so much that our body is like, this is not ideal.
Yeah.
We must not be safe. And the pelvic floor is going to be sensing into that and being like, well, we're not going to let you go. We love you so much. We're going to protect you until everything is good. And we may not find that state. So working with a pelvic health PT can be really helpful because we can literally access all 15 of those pelvic floor muscles and tell them, hey, you're safe. You can relax. You can release. You can come back into your length tension relationship where you feel safe. And we can help rewrite that story physically in the body.
So what would you say is like the characteristic or the identifier that somebody has pelvic floor dysfunction?
Ooh, okay. There's so many. And it's crazy because a lot of these things in our society, we've been told, oh, this is common.
Right.
But just because something's common does not mean it's normal. That's like the mantra of pelvic health PT, right? Just because something is common does not mean it's normal. So feeling disconnected from yourself can be a hint that you're having pelvic floor dysfunction. Like if you feel like you can't get into your core, like if you're lifting and you're like, I just don't feel like my core is engaging, that is pelvic floor dysfunction. If you have a tight jaw, if you have TMJ issues, tight upper cervical, like neck stuff going on, if you grind your teeth at night, that is a key kind of indicator that your body's sending you messages that your pelvic floor is probably tight and restricted.
Which a lot of people just use like Botox to help with TMJ.
Yeah.
And I know in some cases, even when I did see a urogynecologist, the suggestion with like me not emptying my bladder out and having issues with how I was urinating was they do Botox in the bladder. And I know that we've even talked about this before, but I feel like that connection that TMJ has to the pelvic floor is missed, or even the muscles in the mouth that we just talked about.
100%.
All of that I feel like is missed, just how connected everything is to the pelvic floor.
Yes, and kind of my mantra is everything's a tool. There's neither good tools nor bad tools. It's all about how we're using the tools. So Botox can be a really great tool if we're like, hey, we're in this pain cycle and we need something to interrupt it. Botox will absolutely interrupt that. Yeah. But will it help you get that connection to your pelvic floor that you need for true healing? Probably not. It's going to actually distance you from your pelvic floor. So that knowing like, okay, I could use the Botox, but my journey does not stop there. It's not a, inject and we're done and everything's great.
Yeah. Yeah, that makes a lot of sense because I feel like I've seen that a lot. And I feel like a lot of people don't know the full story of what pelvic floor dysfunction is. Right. I mean, even you not being able to empty your bladder out fully, that is even like a sign of pelvic floor dysfunction. Your 100%. Pelvic floor is not functioning as it should.
Yeah, I mean, the bladder's designed to hold liquid for 2 to 4 hours. So if you're rushing to the bathroom every hour, or maybe you're going to the bathroom and you're like, yep, just empty my bladder, then I stand up and I feel like I need to pee again and I have to sit back down.
Which is what I was feeling for so long. I would sit on the toilet and then I would stop, and that like stopping feeling immediately, I'm like, no, there's still more. And then I would like squeeze, and I'm trying to talk to the muscles. I'm like, get the urine out. Like, it's so frustrating. Yeah.
And I mean, even like thinking about urgency, like you can ask yourself, is the urgency that I'm feeling to go to the bathroom, does it match up with the amount of urine that I'm voiding? Or do I have a lot of urgency and then just trickles? Right. Like what's going on there? Right. Constipation, also a huge messenger from the body that we're having some pelvic floor dysfunction. There's one particular muscle of the pelvic floor. It's called our puborectalis. And it is a sling-like muscle that wraps around the bottom of the rectum and creates this kink in it. So when we want to poop, when we want to release stool, that kink has to go away. Because if it doesn't, then we're straining and pushing, and we're literally just pushing into this pocket that is created by this muscle holding tension. And it needs to hold tension when we don't want to release things. It needs to let go, just like all 15 muscles of our pelvic floor need to let go and release whenever we want anything to pass through our pelvis.
Do you think that hemorrhoids are a sign of pelvic floor dysfunction? What is your take on that? Because I know a lot of people get hemorrhoids from straining on the toilet. So what are your thoughts on that?
So I would say with hemorrhoids, it's probably like a chicken or egg type scenario. It's like, okay, we're straining and pushing. Do we have like this habit or like this story of, oh, this is how I toilet? I strain and push things out, and that's creating the hemorrhoid?
Yeah.
Or is it this story of like, okay, I have this tightness in my pelvic floor, now I'm straining and pushing against it and creating hemorrhoids. So
that makes
kind of go either way.
Yeah. Well, and I also want to discuss what pelvic floor dysfunction looks like for sex.
Yeah.
Because I know a lot of women suffer with painful sex, which unfortunately is either, it goes one way or another. Either they're told pain with sex is not normal, but give no action steps to help the people who are having pain during sex.
Yeah.
Or it is just like, oh, that's fine. Like you could be a little uncomfortable. And we see that even with like specifically women who are going through menopause because of the dip of estrogen. And there's a lot of vaginal atrophy that starts to happen during menopause. And so painful sex is kind of just panned off as normal because the vagina is drier and it's like use lube and stuff, but they're not really talking about pelvic floor dysfunction. So let's talk about PFD with sex and painful sex and all the age groups that can suffer with this.
Yeah, absolutely.
Yeah.
So I think the most important thing to note first is that we are designed for pleasure. Sex should never feel painful. It should always feel pleasurable. So pain with sex is never okay. It's not something that as a society we should say, oh, that's normal because you are in menopause or you're breastfeeding, so your estrogen's low. Like, let's just accept this. Like, no, it should never be a part of anyone's story. So pain with sex, we call this dyspareunia. That's the medical term. But pain with sex can be from a number of different factors. One of them can be related to story.
Yeah.
So if we experience something traumatic that affected our pelvis is going to hold on to that story because the body never forgets. And truly the reason that our pelvic floor holds on to so much story is because we have the greatest amount of fascia within our pelvic floor, second only to the amount of fascia that we have in our brain. And fascia is incredible. We're actually now seeing a lot of research coming out about fascia because like when I did cadaver studies in grad school, fascia was the stuff that you cut out of the way to get to the good stuff.
Wow.
The muscles, the bones, like just remove all that stuff. And we would spend hours removing fascia, just this worthless stuff.
Oh my Lord.
And now we know, like, hold up,
it's
fascia
not worthless.
is so important.
Yeah.
So literally right now they're doing studies to see if human consciousness is contained within our fascia.
Wow.
Because we've looked for it in the brain, we've looked for it in the heart, it's not there. We think it's in the fascia. If you look at fascia underneath an electron microscope, there are literally tubules of light within this system.
That's incredible.
Yeah.
Oh my
so
goodness.
I don't know, aura, is that like
Aura,
radiating out of our fascia?
Yeah.
But essentially fascia is connective tissue and it creates this web throughout our entire body. Everything is encased in fascia and is interwoven with fascia. And our fascia is essentially our cells' big communication pathway. So if you've ever read the book, The Secret Life of Trees, our fascia basically works like trees living together in a forest. So in a forest, if there's a tree that is sick or needs help, it will send a message via its root system to the surrounding trees and say, hey, I need more water, I need more nutrients, I'm sick, I'm struggling. And the trees will be like, we got you. And they will send via their root system whatever that tree needs. Our cells in our body work in the same way, and their root system and their communication pathway is the fascia that is surrounding them and is embedded through them. The other thing we know about our fascia, it's our big filing cabinet in our body that holds all of our somatic memory.
Yeah.
Everything that's ever happened to our body, everything we've ever seen, heard,
Wow.
any information we take in via our body is held within that fascial system. And the reason the body wants to hold on to these memories is because, like we mentioned before, the body's number one goal is to keep us safe and protected.
Yep.
So that's why our body as a whole is a big sensory organ. We have eyes that see, ears that hear, skin that feels, basically sensing into our external and internal environment at all times, looking for potential threats. And if the body perceives something as a potential threat, it's going to take that information to the fascial filing cabinet, flip through those files and be like, hey, do we have any memories, any recollection of us ever encountering something like this? And if we did, was it for us? Was it against us? Was it a friend or a foe? How should we respond to this? And because our fascial system gets that information first, it's going to be the very first system to react, even before our brain gets that information and maybe logically talks us down and is like, hey, like, we know that in your life, you experienced sexual abuse. Now, the story's different. You are in a relationship with a loving partner that you love and trust. This is not that. But our fascial system is going to respond to that story first. And in the fascial system, it's going to be like, hey, remember that time that something tried to penetrate through the pelvic floor and it was not for us and it was against us and it did not have our best at heart. We need to protect against this because we have this story about it. So that's why our pelvic floor is so sensitive to stress, trauma, and story, because we have so much of that fascia there holding stories. And these stories don't even have to be ours. Like, it could be a friend telling you about trauma that they experienced to their pelvic floor, whether it was the trauma of labor and delivery, whether it was the trauma of falling on their tailbone at a young age, like off of a horse or something, or a car accident, or sexual trauma, like whatever it is, the body's holding on to that memory and being like, maybe this isn't safe and maybe we should shut that down. So story can be a big factor for pain with sex, because if we're trying to get anything up through the vaginal canal, the pelvic floor has to relax and open to accept whatever that is. So whether it is a partner, whether it is toys, whether it is tampons, menstrual cups, gynecological assessments, whatever it is, if we're having pain with any of that, we might want to check into, is there a story here that is not serving me that I need to unravel? So story could be a big one. We already talked about the role of estrogen, the queen hormone. So as estrogen decreases, right? So whether it's during our menstrual cycle, when we have our period, estrogen's at an all-time low. Maybe we're breastfeeding, prolactin is high, and that tampers down estrogen. Or we're perimenopause or in menopause, and our estrogen is dipping again. So in any of those states, estrogen is really important for our pelvic floor because it helps with muscle density and muscle elasticity. So if we don't have that great supply of estrogen, our pelvic floor is going to feel the effects of that, is going to be less responsive to whatever it needs to do. It's going to have less of that length tension relationship where it can fully relax and fully contract, and we're going to lose a little bit of connection to that part of our body.
Which we see also directly in the vagina as well, because that when people go through menopause or any condition where there's low amounts of estrogen, unfortunately, what we see that correlation is that there's a lack of elasticity. There's a loss in elasticity in the vagina. So the vaginal tissue and the epithelium is also always supposed to be thickened. It's supposed to be moisturized, bouncy, but we see vaginal atrophy in women who are going through menopause or even postpartum. And we see that there is a thinning of the vaginal lining. There's less elasticity, and that is so similar to what's happening in the pelvic floor as well.
And as a pelvic floor physical therapist, as someone who can access those pelvic floor muscles, it's so interesting to literally feel those changes, right? So whenever we're doing an internal exam and we're accessing those pelvic floor muscles, many times with clients, I will gently palpate or press on a pelvic floor muscle, and I have to kind of check myself and be like, is this the muscle? This feels like bone. Like, it's so hard. Like, it's lacking that suppleness. It's lacking that fluidity. It's lacking this length tension relationship. And then we go about the process of gently relaxing and releasing that muscle, and it just changes. The whole consistency changes, and you can see the client just have this sigh of relief where it's like, whoa, I feel like I dropped this heavy weight. I feel more open. I feel more light. And it's that story that's being released from the muscle where it's like, you don't have to guard and protect. You are safe.
Yeah.
Our body's constantly looking for safety, and it hardly ever finds it.
Right. And this, I mean, this applies to, you don't have to be even postpartum or even menopause. This even applies to when you have your period.
Yes.
This also applies to having conditions like endometriosis and PCOS, because there's just a lot of similarities with the story of what our uterus is doing. All of this exists within the pelvic floor, and it's being affected. We see like PCOS, there's underdeveloped follicles that can cause this inflammation of the ovary, which is sitting in the pelvic floor. So we see this in like many different ways. The period is another thing. I mean, even for me, despite how many pelvic floor therapy sessions I've had, I always notice that after my period, I feel more tension in my pelvic floor and a little bit of that like twinging when I'm peeing immediately after following my period. And it makes sense because my pelvic floor was tightened during my period.
For like how many years?
Yeah.
So that story can be strong. And also, like, as a physical therapist, I get to work with the story that's held in the body, but we also have story in our mind. So mind and body are always connected, right? Those two areas of intense fascial connection. So any client that I'm working with where it's like, oh, we have a strong story that's being held in the body, I always recommend, hey, let's work with a mental health practitioner as well so that we can address that story in the mind and address that story in the body, because we can start relaxing and releasing the body, telling the body like, hey, everything is safe. You're safe. It's okay. But the mind can self-sabotage and be like, well, you're not safe. And then the body's like, oh my gosh, we're not. And then it just tenses up and tightens again. So, and same thing vice versa, right?
Yeah.
If the mind is like, we're good, if we're doing a lot of talk therapy and we're like, we've resolved all this, we have moved past this, but the body's like, we haven't. Right? It's like those stories are at odds with each other.
Yeah. So it really doesn't matter ultimately how much work you put into making your body safe, because if your mind doesn't feel safe, there's this, you have to break that cycle between the both of them. And that's kind of, I mean, we see that even with reproductive health, that I explain to people that if you have a leaky gut and dysbiosis in the gut, that leaky gut dysbiosis will cause a urinary tract infection, and then urinary tract infections, repeated UTIs, will cause pelvic floor dysfunction, or it'll affect the pelvic floor in a negative way that now your bladder isn't functioning as it should. And when your bladder isn't functioning and your pelvic floor muscles aren't functioning the way that they should, this can cause urinary retention and urinary incontinence, and that can lead to more UTIs. And now you're in the cycle, this endless cycle, and you need to break all three. So to address urinary tract infections, it's not just let's shove probiotics up the vagina and restore that microbiome. It's, well, we need to address the stress and trauma that we have in our pelvic floor now because of the urinary tract infections. We need to address the leaky gut and the dysbiosis. You have to address all of the things and not just one of the things. And sometimes that stress and trauma that you're feeling in your body, it's stemming from your mind, you being afraid, because UTIs are painful. I mean, it is one of my biggest fears. I remember the very last UTI I had when I sat on the toilet and I felt that burning. I was like sobbing because I just couldn't believe I was having another one, and I was in so much pain. I was peeing straight blood, and it's just a horrifying experience. And my mind just like couldn't get rid of that. And I think too, that was the only UTI that I've ever had that I was peeing out clots of blood. So all of my UTIs in the past were painful and bad. But this last one that I had was like a bang, like that. It hit me where it knew it would hurt. And that just totally like messed with like I was just horrified. I was traumatized after that. So that was kind of the start of that forever lasting, what it felt like, forever lasting like trauma of my urinary tract, where I felt burning even though my cultures were negative. I'm like, I feel like I'm having a UTI, and I would just spiral. I would feel burning, and then I'm just like sitting on the toilet crying because I'm like, I'm having a UTI. But then I'm like, wait, am I? Because this doesn't feel like a UTI. It's similar. It's UTI-like symptoms, but it's not a UTI. But what's going on? Why am I having? And it just like messes with your brain and your body.
That story can be so strong. And also, like, we've talked about a lot of stories related to trauma, right? Like sitting on the toilet, peeing blood, trauma.
Right.
But also, like, there are so many stories around us that are given to us by our society and our culture. So, like, one of the biggest things that I believe that we can do to break down story, subconscious story in our lives is to learn more about our bodies, right? Because when we don't know our anatomy, when we don't understand how our bodies work, then we are so susceptible to story.
Right.
Like, if you didn't know, like, hey, I know I'm not having a UTI. These are UTI-like symptoms. There's something else going on. Like, you would have just spiraled into that story of UTI, the UTI story.
Well, and that's, we talked about, so I saw Julia before I went on my most recent vacation. And sorry, I was opening my laptop, but I, right before I went on vacation, I saw Julia and I was telling her, I'm just so nervous because over a year ago at this point, I went to Las Vegas for work and I remember having UTI-like symptoms on that trip. And I completely freaked out that I was having a UTI. But in the back of my mind, I was like, I don't think I'm having a UTI. But at that time, I wasn't doing pelvic floor therapy, nothing. I didn't really know much about my pelvic floor at that time. So I spiraled into thinking I was having a full-blown UTI. I even called my doctor. I was crying. I was freaking out. But like, I was still able to go about my day. So I was like, wait, is this a UTI? Because the UTIs are pretty debilitating. Like, they don't play games with you. If you're having a UTI, you know, like you need medical attention. So I was like, wait, this is so weird because I think I'm having a UTI, but why doesn't it feel like my other UTIs? So that, unfortunately, that was the first time I was on a trip and I felt this burning. So that story was stuck in my brain. So now every time I travel, I have this anxiety of, am I going to have a UTI while I'm traveling? And so vacation, big deal to me. My first vacation in 25 years. It meant a lot to me that I'm like, I do not want to have a UTI. And so having the information, having the education helped with like calming my mind down. So the first full day that I was there, I did scuba diving, and the scuba diving was like 5 hours long. So it was a really long process. And so when I got back to the resort and I peed, I was obviously like, I went all these hours without water. So there was a burning sensation when I peed. But because I knew enough about my body, and I was able to ease my own mind and say, Gianna, you know that this is not a urinary tract infection. You didn't drink water. You're just a little dehydrated. Calm down. Like, just open up an electrolyte packet, rehydrate yourself. And I was good, but I was able to calm myself down. And that shows like so many people just don't know this information. So it makes sense why so many people would just spiral with these infections and these symptoms.
Absolutely. Yeah. And I mean, like, the more we know about our bodies, the more that we can take back control and ownership, and we can come into a more loving relationship with our body, because the fact of the matter is our body loves us unconditionally. And when we experience pelvic floor dysfunction or, you know, anything in our body, we can get into this line of thought where it's like, oh my gosh, my body hates me. Like, I don't want to have a UTI on vacation. Body better not ruin my vacation.
Right.
Like, we can get into this story that, oh my gosh, like, my body hates me.
Or like, I'm unlucky. I remember feeling that when I went to Las Vegas. I was just like, I would be the one to get like a stupid UTI while I'm in Las Vegas, like in another state. And like, it's just so sad looking back, like how I was like talking about my body, like, I'm unlucky, my body would do me wrong, like I believe them, like my body. And I kind of had that sentiment for a really long time with all my UTIs, because I would feel like, oh, everything's good, life is great, and then a UTI would happen and I would feel betrayed by my own body. So I'm like, my body would do this to me, my body would betray me. And that negative talk also affects,
it totally does. And our society perpetuates that kind of distrust for our own bodies, because we have all this messaging that's like, oh, the female body is this great unknown,
right?
Like, we're gonna know more about Mars probably this year than we do about the female body. Like, it's just insane. Like the full anatomy for the clitoris wasn't included in medical texts like up until a decade ago. Like that is insane.
Yeah.
So our society perpetuates this mistrust of our body, you know, that we are unable to know ourselves, that we are unable to listen to the messages of our body. And the reality is our body loves us unconditionally. It's our sacred life partner, and our body's always going to try and protect us and show up for us in the best way. And we can kind of misinterpret those messages, right? Because the only way the body can send us a message, like it can't just tap us on the shoulder and say, hey, Gianna, just wanted to let you know we're feeling a little nervous about vacation because we have this story about vacation. And we had that UTI and we're just a little nervous about this vacation, right? So we're starting to protect you. We're going to tense up and guard a little bit. Don't worry, like you might feel a little bit of burning, but it is not a UTI. Like our body can't talk to us like that. The only way that our body can talk to us is through pain, signs, and symptoms. Because these are the physical messages of our body getting our attention and saying, hey, we don't feel safe. Can you help us out here? We want to do best. We want to do the best for you. We need your help here. Look here. Look here.
That makes a lot of sense. And I guess that would be where you suggest that when people are almost struggling with that connection, that you would say like seek out pelvic. What would be the point where you're like, this is where I think like someone should seek out pelvic floor therapy?
Oh man. Okay. So I think everyone should have the experience with a pelvic health PT, because you get to come into a deeper relationship with your pelvic floor muscles than you will probably ever have the chance to do on your own. And especially as individuals with female reproductive organs, like that pelvic floor as your gatekeeper for your reproductive organs, like that is your root. That is the center. Like your body is doing so many processes that are connected to that area. So having that connection with yourself on that deep level in your body, I feel is vital. Like everyone should have access to pelvic health PTs, whether you have a pelvic floor dysfunction or not. Like getting that information is super helpful.
And not all women after childbirth have pelvic floor dysfunction, but it's still necessary. Can you talk a little bit why it's so important for postpartum mothers to do pelvic floor therapy and what that means for their body and how it sets them on a good path for recovery? And I also want to hear your thoughts. This is kind of a loaded question, but I want to hear your thoughts a little bit on pelvic floor dysfunction and if you think that there's any connection to miscarriages. I know that that's something that a lot of people have been like wondering. So let's talk about why it's important after childbirth, because obviously you don't have to have pelvic floor dysfunction to do pelvic floor therapy, as you said. And not, well, maybe do all women after labor have pelvic floor dysfunction? Would that be pelvic floor dysfunction? Just giving birth, is childbirth in itself enough trauma to label as pelvic floor dysfunction?
Yeah, this is a great question. So no matter how smooth your delivery is, no matter what kind of delivery you have, it is a huge physical feat for the body. And the body is recovering and healing. So in that fourth trimester, that acute postpartum phase, your body's undergoing a ton of healing. Uterus is shrinking to its pre-pregnancy size. The wound in our uterus from our placenta is healing. We have all these hormone cocktails that are affecting every single cell in our body. Our hormones are balancing. Like there's just so much going on. There's so much healing that's taking place. And there's also so much transformation that's taking place. Like when you have a baby, you will not be the same. You come into this new evolution, this new transformation of yourself and your body. So it's a really great period of time. And also, we know that our pelvic floor is our protector. So as things are healing, as our reproductive organs are healing, our pelvic floor is going to be tensing and tightening, essentially creating that impenetrable wall around that space, saying we are protecting this area as it heals. And we also talked about that protection is great, but we want those muscles to have their full length tension relationship. So what I recommend is that every single person postpartum, and a great time to see your pelvic health PT postpartum is 6 to 10 weeks after you
Perfect.
deliver. That is a great time to see what is the state of my healing,
Yeah.
right? Because that 6-week follow-up appointment with your OB-GYN,
Yeah.
I mean, those of you who've had it, you tell me if it was remarkable or if it was super lackluster, if they were just like, hey, how's your, if you had a C-section scar, how's your scar healing, and are you still bleeding, and what are your plans for birth control, are basically what's typically
the
discussed.
conversation,
yeah.
right.
But if anyone has ever had, a 6-week follow-up appointment and they talk about your pelvic floor or look at your pelvic floor, let me know, because that will be the first I've ever heard of. So anyways,
crazy.
they're not looking at
Yeah.
that. And that is the area of our body. They're not looking at the places where we want to see, okay, are we healing?
Right.
So after labor and delivery, our pelvic floor is going to be tense and guarding. We need to release those pelvic floor muscles. And it is so cool to feel that sensation as a pelvic health PT of feeling those muscles almost take like a big breath of relief and being like, okay, we did our job. Everyone's safe. We can let go again.
I love that. Yeah.
So also like looking at C-section scars. So I have 2 books on Amazon if anyone's interested. One of them is all about C-section scars, and it's the 5 things your doctor never told you about your C-section recovery and healing. And like this information needs to get out there, because with our C-section scars, what you see on the surface is just like the tip of the iceberg. The way that C-section scar is healing is because we cut through 9 layers of abdominal tissue. We have these deep anchors that are anchoring deep into the body. Maybe they're anchoring to our bladder and affecting bladder function. Maybe they're anchoring all the way back at our tailbone and sacrum and affecting the way that our low back is able to function. Maybe they are anchoring to our pelvic floor and affecting pelvic floor function.
Yeah.
So when that C-section is healed, when the body has fully brought those tissues back together, we need to mobilize that scar and have it become a part of the body again, bring up those anchors so we can have good sliding and gliding of the tissues, because we know in the research that anytime we have an area of sticky tissue, whether it's a adhesion, a scar, we can have 22 pounds per square inch of added pressure being exerted into our deep core system.
Wow.
And that is pressure that our pelvic floor has to hold up.
Right.
And also with where that C-section scar is, we're cutting right into our transverse abdominis.
I was going to say, you're cutting through one of the very important parts of the pelvic floor.
Exactly. So yeah, that's why a lot of individuals who've had C-sections are like, I just do not feel like I'm connected to my core at all. And that's because, well, we cut through it, and we also anchored down and tethered this tissue so that when our transverse abdominis wants to zipper in and up and draw that energy up through our core, it's literally being held back, physically being held back.
Yeah.
So mobilizing those scars is really important. And the same thing with perineal scars, right? That can be a big driver for pain with sex or pain with any sort of insertion through the pelvic floor. So that scar tissue needs to become a part of the body again. It can't be this foreign object that is holding our body back from fully expanding and relaxing.
Yeah. And I know you and I have talked in the past about how there's like 3 different nerves within the pelvic floor, and they lead to 3 different areas of the pelvic floor. And this can cause symptoms. And what we know, and a lot of people, especially after childbirth, experience things like vulvodynia.
Yes.
And unfortunately, that's kind of just a word that's thrown out, or vaginismus.
Yes.
And it's just like, oh, here's the symptoms, pain with sex. And you have a burning, tingling sensation. There's so many people who are like, I think I'm having BV or a yeast infection, but I'm not having any discharge. I'm not having any positive cultures or anything, but I'm having this burning sensation in my vagina. Or some people say they're having burning sensation in the perineum space, the space between your butthole and your vagina. And so can you talk a little bit about what actually is vulvodynia and vaginismus? Because what we know, both myself and Julia, we know that it's a nerve problem, but that's not talked about enough. So can you talk about those nerves and the pain that it may cause, or those symptoms that it may cause for each of the 3 nerves and where they're attached to and stuff like that?
Yeah, so vulvodynia, vaginismus, very much like bucket terms. That if you go to your doctor and they're like, okay, well, you have these collection of symptoms, let's dump you into this collection of symptoms bucket and give you this label.
Yep.
So in the pelvic health world, this really doesn't tell us where is this stemming from. It's just saying that there's pain.
Right.
Where is that pain coming from? So you were talking about kind of the queen nerve of the pelvic floor, which is our pudendal nerve. And our pudendal nerve has 3 separate branches branches that go to 3 separate places within our pelvic floor and create that innervation, that sensory supply, and also some motor supply to those areas. So whenever the pelvic floor is tensing and tightening, those nerves that are embedded through the pelvic floor, and in fact, our pelvic floor has the greatest innervation of any other part of our body, second only to the brain. So lots going on in the pelvic floor, right? When those muscles start to tense and tight, those nerves are going to get compressed.
Yeah.
And nerves do not like compression.
Right.
They are a little claustrophobic. They do not want to be squeezed. And when they feel squeezed, they only have a very select vocabulary in which to say, like, hello, we would like more space, right? So vocabulary for our nerves is burning, tingling, numbness, sharp shooting.
Yep.
That's basically what we got.
Yeah.
So the nerves are going to be like, hello, we're feeling compressed. Here's a message from us.
So the symptoms are the way that the nerves are trying to communicate to us that they don't feel good.
Exactly. 100%. Yep. And then feeling that nerve sensation of that nerve talking, you're going to be dumped into one of those buckets.
Yeah. Yeah. I think that's like missed a lot. And that can cause, you can have that burning, tingling sensation in either of the 3 brackets or all of the 3. And that could be in the vagina. We know that. And then one of the branches goes to the perineum.
Yep.
And then the other is the butthole.
Yep. You got it.
There we go. Yeah. So all 3 branches. So you can feel that in many different areas. And I think it's just so frustrating because the traditional theory is, well, if you're having a burning sensation and these symptoms, it's possible there's some kind of infection going on. And when that infection is not discovered, then it's kind of like, well, you're a medical mystery. There must be some mystery going on. And vaginismus in particular is like very confusing for a lot of people dealing with it, because a lot of times it's like, well, there's pain upon insertion, but they can't pinpoint why that pain exists. And sometimes when they go to the gynecologist and an exam is done and they are looking at the vulva, there's no redness, there's no inflammation, but this burning sensation exists.
Yeah.
Yep.
Yeah, because as a medical model, we're like, burning equals infection. Where's the infection?
Right.
And then if we can't find the infection, our medical model is set up that we are going to do everything we can to find that infection. We're going to take biopsies of everything.
Right.
We're going to cut into your body, take little pieces of you.
Right.
And we're going to look so hard for that infection that maybe we cause an infection.
Right.
Yeah.
So I think if someone is interested, like especially after watching this, and they're like, I want to do pelvic floor therapy, but as you know, unfortunately, there's a ton of insurance companies that don't cover pelvic floor therapy.
Yes.
So what is your best advice to someone who wants to maybe do pelvic floor exercises even at home? What are some things that they can, I know like we've talked about, I run my business and I sit a lot.
Yeah.
I do a lot of sitting on my office chair, and you have given me pro tips to think about when I'm sitting down. We've talked about like the use of a tennis ball when I'm free and stuff. So what are things that you would just like recommend? And I mean, I guess it's up to you how you want to break this up, if you want to give advice to like new moms or advice to working individuals or just in general. What would be your tip for at home exercises, if you will, that you suggest people to do if they don't have access to pelvic floor therapy or a pelvic floor therapist?
Yeah, great question. I dream and believe in a world where we will have access to pelvic health PT for everyone, for everybody. So
I'm on that dream with you.
Yeah.
We both have this dream.
But for right now,
For right now,
we
will give advice.
yeah. So obviously, if you can have access to working with a pelvic health PT, do it. If you want to use your insurance, work with someone who's in network. If you want to go outside the box and experience something a little different outside of insurance-based protocols, then find someone out of network. You'll probably have a different experience, but both can be really great. So whatever you have available to you, go for it. If you're looking for ways out at home to essentially increase the health of your pelvic floor and have a really healthy pelvic space, health starts from the inside out. So our pelvic floor needs hydration for the extensibility of that tissue. We need nutrients for the pelvic floor. So we're thinking about healthy fats, protein intake, carbs. We need to be well fed so that our body can work for us. we need to think about our nervous system and how we're caring for our nervous system, because we know that our pelvic floor is our protector. So whenever we feel stressed, whenever we feel fearful, our pelvic floor is showing up for us and supporting us first. So how in our modern day society, where we have so many chronic stressors, can we find things throughout our day to manage our stressors and to, instead of being in that fight or flight state constantly, how can we help our nervous system pendulum back into parasympathetic, rest, digest, breathe, allow, be, whether that is meditation, whether that is drinking your tea slowly, whether that is going for a walk on your lunch break, getting out into nature.
And supplements like with Harmony probiotics.
And supplements for sure. Yes, I take them. I take Gianna's probiotics. I love them. I also am not affiliated with this company, but they're great. Yes. But anyway, movement, our body needs movement. So getting your body moving. Probably a lot of people were thinking I was going to say Kegels or Kegels.
Yeah.
For us in our modern day society, most of us do not need those.
Right.
We need our pelvic floor to relax first so that we can strengthen through that full range of motion.
I'm so glad you mentioned that, because when you search pelvic floor therapy, it's always Kegels, 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 Kegels. That's the first thing that comes up. And I remember once I started coming to you and learning more about my pelvic floor, I was like, well, shit, I don't need Kegels. I already have, my pelvic floor is too tight.
Yeah, you're
That's
so
the problem.
good at contracting.
Right.
Pelvic
so
floor,
I
great
need
at
to
contracting.
relax it. Like I need to do the opposite. Like I don't need to further contract it. So I think that's the difficult thing with seeking at-home remedies is because unfortunately the things you'll find on TikTok, on YouTube, on the internet are like one size fits all, and you'll find things like a Kegel, but like seeing an actual pelvic floor therapist is so helpful because they can cater the treatment specifically to you.
Exactly.
Yeah.
So can figure out whether your pelvic floor needs Kegels. Most likely it doesn't.
Right.
But you can know for sure, right? So we want to think about, for most of us who have tight and constricted pelvic floors because of the world we live in, we want to think about ways that we can bring our pelvic floor back into that relaxed position.
Yeah.
And our breath is our big release tool in our body. So practicing getting our breath down into our pelvic floor, expanding our bellies, getting our breath into our back body as well, and creating that space. And where our breath goes, that's where our awareness goes. So connecting with our bodies in a loving way, thinking about, you know, what our self-talk is like. Are we hating on our bodies all the time and sowing distrust? Or are we like, you know, sending loving kindness to our bodies on the daily, sending that love and light, and sending that breath down into those spaces. That's the work. That's the work of caring for our pelvic floor, and kind of everything kind of rests on top of that. Having a really great connection to your pelvic floor will connect you so much deeper to who you are as a person. Yeah. And pelvic floor health looks like all the things that we talked about. It's the working out, it's the getting mobility, it's the eating and drinking and giving your body all the things it needs. But truly at its deepest level, it is coming home to yourself and doing that work of, can I access the places that society has told me are dirty or sinful, or I should not be in that place? Can I sit in that place and love myself there?
Yeah, and I think too, I mean, society has even shamed women for knowing their own vaginas and exploring their own vaginas. And we know, like, even the pelvic floor, the layers, you can reach the first, second, and third layer of your pelvic floor with just a finger. And that seems taboo to even think about, but we're so, I feel like, as women, trained to be so disconnected from our reproductive organs and reproductive health, that it just seems like an afterthought to care for it. And I know, like, even now, for me to get breath into my pelvic floor, I notice myself, like, I'm so connected now with my pelvic floor that I do it even when I'm driving. So driving, even that, I feel like is a stressor. It's such a stressor, driving. And I'm sure Julia got lost coming up here today.
I did. So, I felt like a stereotypical uneducated dude trying to find the G spot. And I'm like, I'm literally on the other side of the river. I was not even close.
So it's like that in itself is just like stressful. Like I'm driving through rush hour and I just feel like my body is tense and I can feel that tension. And then all of a sudden I get like a twinge in my urethra and I'm like, ooh, I need to breathe. Yes. And then I'll take like a deep breath into my pelvic floor. Sometimes I'll even at a stoplight, like put my hand on my pelvic floor and feel the breath go in and just connect. So sometimes it doesn't have to be something like extravagant to connect with your body. It can be sitting in an office chair while you're in a meeting or just taking that deep breath while you're taking a moment to lay down. Like it doesn't have to be anything like crazy.
Yeah, totally. Yeah, our pelvic floor follows our breath. So every time we inhale, our pelvic floor naturally lengthens and elongates. And every time we exhale, our pelvic floor does that natural Kegel contraction.
Yeah.
So if we are in connection with our pelvic floor, we are strengthening and mobilizing our pelvic floor with every breath.
Yeah.
And I think also something else is kind of tearing down those societal taboos where it's like suck in your stomach.
Right.
No, let your stomach out because that'll help your pelvic floor.
Absolutely.
Yeah. I think those are really good tips.
Right. Yeah. No, I mean, it's just so important to think about your pelvic floor because it is really an afterthought. It's something that I said it earlier and I'll say it again. Like I didn't even know how much critical attention my pelvic floor needed until I, being a biomedical engineer, was reading some research and papers and medical journals and was like, the pudendal nerve, the pelvic floor, like what is all this? And then questioning it and saying, maybe it's worth I do a discovery call and see if it's even worth going to pelvic floor therapy. And it's frustrating that so many women obviously don't know this information and wouldn't be able to just seek this out. They're waiting for someone to tell them.
Exactly.
And that's why like doing the thing that we're doing right now, making this educational podcast episode to bring this information to you, because you might watch this and be like, after watching it, be like, shit, I need pelvic floor therapy. I need to see a PT. So
yeah. No, these avenues are so amazing. In fact, what really helped the pelvic health movement take off in the United States was TikTok.
Yeah.
Really did it. Like brought it into the light and was like, hey, we need to start talking about this.
I love that.
Yeah. So podcasting, like when I first started in pelvic health, there were literally 5 pelvic health podcasts. That was it.
Oh my God.
Yeah.
Wow.
Like I could read all the blogs because there was like 3.
Right.
Like there was nothing. And now we have all these avenues to really like scatter this information around like confetti.
Right.
And have that pelvic health parade.
Yeah. That's so exciting. I'm so happy that I brought you on the podcast.
Me too.
It was just so fun. I feel like even I constantly am learning something new from you, Julia.
Same.
Like literally
Vice
all the
versa.
time. Every time we see each other, it's like we're feeding each other new information. And that's why I love being in this space. And the best part is that we're both so eager to keep learning more.
Yeah.
We're not just like, oh, we learned this information and this is Bible and we have to take, we are very much like, no, new and emerging science is growing and evolving, and we want to keep learning. And I think that that's so important for this space.
Yeah, and following the research, because the research for pelvic health care is so untapped.
Yeah.
For vulvovaginal care, so untapped. So it's like, show me all the new data. Tell me what's going on. I want to know.
Yeah.
Because we have so much to learn and discover.
Yeah. Can you leave the audience with like words of wisdom, piece of advice, anything that you feel like the audience, you want them to take away from both today's episode and just like life? What is something that you would want them to know? I know for me, I would always encourage them to not feel like they've hit a dead end and like an end, like a roadblock. Roadblocks are tough because mentally you feel like you've had enough. And I will say, like, I felt that way too once I was like not having urinary tract infections, but I was still having those symptoms. And mind you guys, I had already at this point started my business. So it kind of messes with your brain a little bit where you feel like a failure because you're like, I literally am not having a UTI. I created this business and I create educational content. I created these products, but I'm still having like pain and what is going on and like tapping into myself and finding out what the issue is. It's a little discouraging, but I encourage you all to not give up on your body and on yourself. So I'm curious to know what would be your like final sharing thoughts.
Yeah. I have so many.
Aww.
So I think I'll just end with just encouraging you that your body loves you so much. Like every day I talk with individuals who feel betrayed by their bodies, that feel that their body's broken, and that is not the story that's true. It's literally not. Any symptom, any pain, anything you're experiencing in your body is a loving body trying to get your attention and say, hey, we want to take care of you. We need to get help. And seeking out that help is really important. Like, we were not meant to go through life on our own. Healing does not occur in isolation. Reaching out for that help and getting support from practitioners and people that you know, like, and trust is really important. And then also, like, get to know your body. Breathe into those spaces. You know, you do some vulvar mapping where you have a guide where you can literally touch and feel your vulva. And if you want to get into the vaginal canal and feel your pelvic floor muscles, do it. Like, you should know and understand your body, because it is yours. It is your sovereign life partner, and it loves you so much. I think tracking your menstrual cycle, I'm a huge proponent of that for anyone who has a menstrual cycle. Like, that is your body's 6th vital sign. It is sending you messages every single month about the total health and wellness of every single system in your body, from your cardiac health to your bone health. And like, if you've gone to the doctor, most of them, because they need to ask you about your 6th vital sign, they'll say, when was the date of your last period? And you're like, oh man, let me look. But also, what are they doing with that information? Practitioners right now,
probably nothing.
Many of them don't really know. But this is information that you can use to see, okay, are my hormones balanced? Am I ovulating? Because that ovulation is essential for releasing progesterone, which is a mood stabilizer, and it's brain protective, it's heart protective. Like, you can get a lot of information. Your body is sending you messages constantly. And my advice is listen, because your body wants to feel heard, seen, and understood.
Yeah, that's so beautiful. Ugh, I love you. You're the best. I'm so happy that you joined me today in the G spot for this episode. Honestly, I feel like there's just so many more things that we could talk about, but this episode would be like 5 hours long. I know. So if you guys love this episode, let us know in the comments, because I can have Julia back. We can do a part 2 if you're willing to attend.
I would love that. I would love that.
So I'm just so happy. We had such a good time, and I think this leaves you guys with so many actionable steps and just new information and knowledge. And I hope you all feel empowered after watching this. So a big thank you to you, Julia, for coming. Thank you so much.
Thank you for inviting me.
Of course.
So fun.
Of course. So fun. But yeah, guys, I think that's it. This was such a great episode. I had such a good time. And I want to say happy International Women's Day to all of you. I love you all so much. I hope that this episode left you feeling strong, encouraged, empowered, comfortable, safe, and excited for what's to come in female reproductive health.
Yes, I agree. Thank you so much. It was great to
guys.
hang out with you all.
Yes, it was so nice talking to you guys. And without further ado, I will see you guys in next week's episode. Bye, guys.